As a healthcare provider, you know that high-quality CPR is the foundation of pediatric advanced life support and should be practiced often by anyone who treats children. As we discussed earlier, patient survival depends more on effective CPR than on advanced treatment. Without effective CPR, PALS interventions will fail. You are now going to practice and be tested on your CPR skills. We'll start with giving high-quality compressions and breaths using a pocket mask. The 2010 AHA guidelines for CPR and ECC recommend a change in the BLS sequence of steps from ABC, airway, breath, chest compressions, to CAB, chest compressions, airway, breaths, for adults, children, and infants. In the ABC sequence, chest compressions are often delayed while the rescuer opens the airway to give mouth-to-mouth breaths, gets a barrier device, or gathers and assembles ventilation equipment. By changing the sequence to CAB, rescuers can start chest compressions sooner, and the delay in giving breath should be minimal, only the time required to deliver the first cycle of 30 chest compressions, or approximately 18 seconds. For two rescuer infant or child CPR, the delay will be even shorter. Another key change is the removal of look, listen, and feel for breathing from the assessment step. The healthcare provider should not delay activating the emergency response, but should check the victim for two things simultaneously: response and breathing, followed by a quick pulse check. With the new compression first sequence, CPR is performed if the child or infant victim is unresponsive and not breathing, or only gasping. Begin CPR with compressions. That's the CAB sequence. After the first set of chest compressions, open the airway and give 2 breaths. During this course, for any one rescuer activity, you will be using a pocket mask. When practicing multiple rescuer scenarios, you will always use a bag mask device. Let's take a look at one rescuer child compressions and ventilations using a pocket mask. Just watch now. You'll have a chance to practice momentarily. Put the heel of one hand on the lower part of the breastbone. Remember to push hard and push fast. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters. After each compression, allow the chest to recoil completely. If you are unable to compress to the correct depth with one hand, either due to fatigue or lack of upper body strength, use 2 hands to provide ongoing high-quality compression. After 30 compressions, do a head tilt chin lift and give 2 breaths, each over 1 second using a pocket mask. Make sure you can see the chest rise. Right now, your instructor will pause the video to allow you to get into position to practice all the steps in order. Okay, now that you're in position, let's begin. Follow along with the video as you practice, and switch students on the mannequins when the video instructs you to. You'll deliver 5 sets of 30 compressions, followed by 2 breaths after each set. Are you ready? Here we go. Hey, are you okay? Not breathing. You, activate the emergency response system and bring in AED. No pulse? 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2,
you okay? Not breathing. Not breathing. You, activate the emergency response system and bring an AED. No pulse? 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
'Next, we're going to practice two rescuer infant CPR using a bag mask device. When you have two rescuers doing infant CPR instead of one, there are two main differences: the preferred method for performing chest compressions and a compression to ventilation ratio of 15 to 2. For compressions with one rescuer, you place the tips of your two fingers in the center of the infant's chest, just below the nipple line. Then press hard and fast. For two rescuer CPR, the preferred method for compressions is called the two-thumb encircling hands technique. Place both thumbs side by side on the lower half of the breastbone, ensuring that the thumbs do not compress on or near the tip of the breastbone. The thumbs may overlap in very small infants. Encircle the infant's chest and support the infant's back with the fingers of both hands. With your hands encircling the chest, you'll use both thumbs to depress the breastbone at least 1/3 the depth of the infant's chest, about 1.5 inches or 4 centimeters. Deliver compressions at a rate of at least 100 per minute and allow the chest to recoil completely. Remember to count out loud as you press. The second difference when you have two rescuers performing infant CPR is the compression to ventilation ratio. With two rescuers, you will perform 15 compressions, then pause as the second rescuer gives 2 ventilations, with each ventilation given over 1 second. Coordinate compressions and ventilations so that you are not pushing on the chest while the second rescuer is trying to give 2 ventilations. Also, avoid producing excessive chest rise with ventilations. You want to see the chest just begin to rise. Your instructor will put you on teams. After you've completed the practice session, you will switch roles and practice again. Right now, we're going to pause the video to allow you to get into position to practice. Okay, now that you're in position, let's begin. Follow along with the video as you practice and switch roles when the video instructs you to. Normally, rescuers would switch roles after 10 cycles or about 2 minutes. For the purposes of this practice, you will switch roles after 5 cycles of 15 compressions and 2 ventilations. Are you ready? Here we go.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Although AEDs may differ slightly, there are universal steps for operating an AED. First, turn on the AED. Open the carrying case or top of the AED. Then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the pediatric pads on anyone younger than 8 years of age. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. If multiple rescuers are present, one rescuer should continue chest compressions while another rescuer works to attach the AED pads. Place one pad to the side of the left nipple in the mid-axillary line. Place the other pad on the victim's upper right chest, directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm. Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then, loudly state a clear the victim message. Perform a visual check to ensure that no one else is in contact with the victim. Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, immediately resume CPR beginning with chest compressions. Do not remove the AED or turn it off. The AED will repeat the analyze and shock cycle every 2 minutes. When the AED indicates no shock advised, you do not check the pulse first. You immediately start chest compressions again. In a moment, you're going to be tested on your skill in 1 and 2 rescuer CPR. Right now, we're going to show you the entire sequence of child CPR, including assessment.
Hey, are you okay? Not responding? Not breathing? You activate the emergency response system and bring an AED back. No pulse? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 2, 3, 4, 5, 6, 7, 9, 10, 11, 13, 14, 15, 16, 17.
Attach pads to patient's bare chest.
3, 4, 5, 6, 29, 30. 1, 2, 3, 4, 5.
Plug in pads connector next to flashing light.
12, 13.
Analyzing heart rhythm. Do not touch the patient. Shock needed. Charging. Stay clear of patient. Press the flashing button now.
Clear to shock on 3. 1, 2, 3.
Shock delivered. Begin
1, 2,
CPR.
3,
Start
4,
with
5,
compressions.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6.
Now, let's review the entire sequence of infant CPR.
Baby. Greg, I think we got a problem here. Greg, she's not breathing. Activate emergency response.
Got it.
One, 2, 3, 29, 30.
Help's on the way. Let's start 15 and 2. Great chest rise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 8, 9, 10, 11, 12, 13, 14, 15. Let's switch.
Now you're going to be tested. Think of this test as a real-life emergency situation. You should do whatever you think is necessary to save the victim's life. You will have to determine for yourself what you need to do. Once you start, your instructor won't be able to answer any questions. Remember, if you make a mistake or forget to do something important, you should not stop. Just continue doing what you would in an actual emergency until your instructor tells you to stop.